إن شاء الله دكتور علي إن شاء الله. Okay, doctors. What I want till Dr. Amaro finish. What I want you doctors to do, just to download the mark sheet. This is very important. If you don't have the mark sheet for the station 4, for station 2, sorry 2, I'll send it on the group, okay, so that you can see how you will be evaluated, and also how to evaluate your colleague. Okay, so till she finishes, I will send you the mark sheet for the station 2. So, I didn't find it. Sorry. Okay. Oh, there's some. Okay, Dr. Marwa, so you are ready? Just 1 second. Doctors, I'm not sure if my screen is shared with you or no. Now, is it shared with you? The word only. Okay, it's good. So 1 second, I will share the mark sheet on the WhatsApp group so that you should evaluate your colleague, and then also you will know how you will be evaluated. Next times, inshallah, next times we will try to evaluate each other. Okay. So this is the mark sheet. I will share it now on WhatsApp. Okay. Okay, Dr. Marwa, you can start. Oh, you are muted. 1 second. Doctors, you can find it on the group now. On our WhatsApp group, you can download it and know and see how everything is being evaluated. طيب. بسم الله. Okay. Dr. Marwa, can you raise your hands, please, because you went down. Dr. Marwa, you are here. Can you please raise your hand? Did she leave? I cannot see her online. Okay, Dr. Marwa, you are here. Marwa, let's search for here. Okay, I think she left. So who will take the case? Dr. Muhammad Imran. Are you ready, Dr. Muhammad Imran, to take the case?
Yes, doctor, I am ready. I can, but just give me 2 minutes to prepare myself.
It's okay, Dr. Muhammad. Take your time. But if Dr. Marwa came again, we will live here.
Okay.
Okay. So other doctors, please have a look on the WhatsApp group and see the mark sheet how it's being evaluated. I'll just mute myself for 1 minute. Okay, Dr. Muhammad, are you ready? Because now we spent lost lot of time.
Okay.
Okay,
Shall I
Dr.
start?
Muhammad. Yes, you can start. Go on.
Good morning, Mr. Tani.
Mrs.
Mrs. Tani.
Yes, good morning, Doctor.
I'm Dr. Sharif from Medical Clinic. Nice to meet you.
Nice to meet you, Doctor. Thank you.
Just I want to confirm that you are Mrs. Tani, 56 years old,
Yes, that's here.
and you came with joint pain, bone pain, sorry.
Yes, Doctor. I'm having some bone pain.
Would you like to talk more about this condition, when it was started exactly?
Yes, Doctor. You know, for the last 6 months, I started having bone aches. It's annoying me so much because, you know, whenever I'm trying to do anything, I feel pain all over my body, all my bones. I feel that they are aching so much. I don't know what is the cause.
I'm so sorry for that, and be sure I'm here to help you, Mrs. Tani.
Thank you.
This bone ache in all bones of your body?
Yes, doctor, nearly on all my bones.
It's coming in the morning or on the evening or all the time with you?
No specific time, doctor.
So all the time with you since
Yes,
for 6 months?
most of the day, most of the day.
Okay. So it is increasing by any factor like exercise or walking or trauma?
No, I didn't notice that something make it worse. But you know, when I start doing things, I feel, you know, I feel pain. Even sometimes I ask my daughter to come and do some massage for me, but even I feel pain still.
Yes, after some time pain will go, or it will be all the time with you during exercise, during doing
Not
some
all the day,
daily
not all the yes, not all the day, doctor, but most of the time it's with me.
yeah. Okay. Any accompanied by any joint pain?
I don't have any joint pain, doctor.
Okay. This bone ache, if I told you the minimal pain is 1 and maximum is 10, how much you will give this pain?
Sometimes it's 3 or 4.
Yeah. It is approved by any medications like analgesics.
Analgesics? What's analgesics, doctor?
Yes, painkillers.
Painkillers, sometimes I use paracetamol. It helps sometimes, but it's not that help. Sometimes it helps, but not always.
Yeah. This bone ache is accompanied by any elevated body temperature.
No body temperature, no, doctor. It's not high.
Elevation. Yeah. Okay. Okay. This bone ache is there is any headache with this bone ache?
No, doctor. No headache.
How about your mood? Can you tell me, please? You are feeling low mood.
Yes, doctor. This bone aches makes me annoyed most of the time, and makes my mood very bad mood.
This bone ache started first before this bad mood.
The bone aches, yes, it started before the bad mood. Yes.
Okay. You seek any doctor for this bad mood or any help?
No, it's not that severe that makes me depressed all the time, but I feel that I am not myself. But I didn't seek medical advice for this.
Okay, you are feeling that life is worth.
Yes, doctor, my life is worth. I am a grandmother now. I like my family so much. I like to be with them.
Yeah, I appreciate that. Mrs. Annie, you have any weight loss?
Weight loss?
Yes.
Yes, doctor, I'm having weight loss.
How much?
About, uh, I couldn't say exactly, but you can say about 1 stone or something like this.
Over how long time?
Maybe for the last 1 year.
It was intentional, like you are doing any diet.
No, doctor, it is not intentional.
Okay, how about your diet? Is it okay? You are same diet? Any change in your diet?
No change in my diet, doctor.
Okay. You have any bumps or lumps in your body?
No,
Any weakness in any part of your body recently or in the past?
any weakness? No weakness, doctor.
Any shaking of your hands?
No,
Any heat intolerance or cold intolerance?
no, doctor.
Any difficulty combing your hair?
No,
Any difficulty getting upstairs?
no,
Okay. You have any shortness of breath?
no, doctor. I don't have any shortness of breath. I'm a lazy
Any racing
person,
of
by
your
the
heart?
way.
What?
I'm a lazy person, by the way.
Okay. Okay. You have any skin rash?
No, no skin rash, doctor.
Okay. You have any bleeding from any body orifices or any easy bruising?
No, I don't have.
Okay. You have any racing of your heartbeats?
No,
Any swelling in your legs?
no, doctor, I don't.
You have any tummy pain?
Occasionally, but this is not severe one.
Which part of your tummy usually you have pain?
I cannot say exactly, but I'm not sure. Maybe on the left side or in the middle. I'm not very sure, doctor.
It is all the time with you or on and off?
On and off.
Okay, when last time you had this pain, tummy pain?
Maybe last week.
How much it last?
Uh, it may last with me for uh, half an hour, 1 hour, like this, an hour.
Yeah,
But it's
yeah. You
intermittent,
have
it's not continuous, doctor.
yeah. You have any bluish discoloration of your eyeball whitening part?
Blue discoloration? No, doctor.
Yellowish, yellowish.
Yellow? No, doctor. I didn't feel like this.
Okay. You have any problem with your back passage? Any constipation, any loose motions, any
No,
bloody motions?
no, doctor. I
You
didn't
have
feel
any
like this.
feeling, yeah, any feeling sick or getting sick?
Yes, doctor. Most of the time, I feel that I'm not myself. This bone aches, makes me feeling bad, and even, I cannot do my usual work. I don't know, is this due to the pain or any other thing?
Yes. Mrs. Annie, with whom you are living?
I'm living with my family, my husband and my grandsons.
And they are healthy?
Healthy?
Yeah.
What do you mean by healthy, doctor?
Husband is good. He's not suffering from any diseases. He is dependent on himself.
Yes, doctor. He is in a good condition.
Yes, yes. Okay. Any social problems, if you allow me to ask, at home?
Social problems at home, like what social problems, doctor? We are a good family, by the way.
Yeah, thank you. I appreciate that, and sorry for this question. Uh, are you smoker?
Do you smoke? Do you smoke?
Hmm, yeah.
No, doctor, I don't smoke.
Are you drinking alcohol?
Do you drink alcohol? No, I don't drink alcohol.
Okay. Can I ask you if you have any long-standing diseases that I should be aware of, like diabetes or hypertension or any other diseases?
No, doctor, never. I was very healthy person before. I didn't have any chronic diseases at all.
Okay. You have any drug list, any medications you are taking?
No, apart from occasional paracetamol, I don't use any other medications.
Any over-counter medications or herbal medications?
Herbal? No, doctor, I don't use herbal medicine. I don't believe in herbal medicine, by the way.
Okay. You are taking you don't have any over-counter medications that you are taking without prescription from doctor?
No.
You have any operations in the past?
Operations? No, never, doctor. I didn't have any operations before.
Okay. You have any blood transfusions in the past?
No blood transfusion.
Any tattooing? Any nail piercing?
No.
Okay. Mrs. Annie, how about your concern?
I'm concerned about this bone pain, doctor. I don't know what's the problem with me. It's annoying me so much. I'm afraid. I'm not sure. 2 minutes remaining, doctor. I'm
Okay.
afraid. What's wrong with me? Is it a cancer? Is it what? I don't know.
Okay, Mrs. Annie, just can I ask you what you are doing for your life? What's your job?
I'm a housewife, doctor.
Yeah. Okay, Mrs. Annie, by history, I took from you that you have bone ache for last 6 months and you have 1 stone weight loss for 1 year. This pain is type of pain which you will prescribe as 3/10 of maximum pain. I want to run some investigations to you and I want to examine you thoroughly to confirm my diagnosis. There is some condition named chronic fatigue syndrome. This condition is coming with some low mood and generalized aches and pains in parts of the body. We should exclude other serious conditions, of course, by these investigations we are going to do. We are going to give you help and support by multidisciplinary team after confirming diagnosis, and we will have appointment as near as possible to give you a plan of management for your condition.
Okay.
How do you think?
So I'm having this chronic fatigue syndrome, doctor. Yes.
Most probably.
Okay. Thank you, doctor.
Thank you. Thank you, Mrs. Annie.
Time. Okay. 2 minutes for or 5 minutes for discussion or less. What's your differential diagnosis, doctor?
Differential diagnosis here in this condition, I put polymyalgia rheumatica, but apart from that, she don't have fever, she don't have loss of weight, a significant loss of weight. She don't have any joint pain, which is improving with exercise or movement. Next, I put chronic fatigue syndrome, and I put endocrinal causes like hypothyroidism, I put also osteoporosis as postmenopausal complications.
Okay. So did you ask here about her family history?
I forget to ask about the family
About
history.
her allergy? Did you ask about her allergy?
Allergy?
Allergy on to medications, to food, to anything?
No.
Okay. Do you think that sexual history is important in such group of patients?
I should ask about her last menstrual period when it was stopped. Maybe because if it was stopped earlier, it will go on more with complications of like osteoporosis, postmenopausal complications.
This is as regards the periods. Okay, but as regards the sexual history, is it important?
I think in this age, it is not significant.
Okay, doctor. So she told you that she is having weight loss and some bone aches. Does she having
With,
any travel history?
I did not ask about travel history.
Okay, doctor. So did you answer her concern? She was afraid that she, she may be having cancer. Did you answer her concern?
I think I told her cancer is for diagnosis. I'm not
Okay,
sure.
so how will you manage this patient? Will you admit her or will the charge or what?
I will run investigations for her at the beginning to check her routine investigation, full blood count, inflammatory marker like SR, CRP. I will do liver function test, kidney function test, and electrolytes to exclude any electrolyte imbalance. I will do for her routine chest X-ray to exclude any massive mass or any sign of like this. If any positive data like anemia, but I exclude from
Did
history
you
if
ask
she
her
has
about
anything
anemia?
needed. Ask about shortness of breath, and she did not express any easy fatigability. She said she has only weakness, bone ache only.
Okay, okay, doctor. Thank you very much. Thank you.
Thank you.
Sorry, doctor, I'm trying to be silly as the examiners, but you know they
No
are
problem.
more silly than this, Dr. Muhammad. Dr. Muhammad,
I forgot to write family history and travel history because
it's
time
okay.
was short actually.
It's okay, no
Sorry.
problem. Dr. Muhammad or Dr. Mahmoud, because I can see MOH only. I know this is MOH, Minister of Health or Dr. Muhammad or Mahmoud. Hello, you are with me, Dr. Muhammad? Dr. Imran?
Yes, Dr. Muhammad
Okay,
Amran.
Dr. Muhammad. Okay, Dr. Muhammad. So, patients, again, doctors, I will repeat it again. I will be happy to repeat it hundreds of times, 100 million times, no problem. Please, doctors, when you are going to station 2 case, you receive a paper outside like this. Please, doctor, divide the paper as this outside. Here, please write your differential diagnosis. Here, write your positive data. And here, write, you didn't ask this patient about how badly this problem affects her life before asking her concern. You didn't summarize the thing for this patient, doctor. Okay, so the I is plus management. And here above you write the patient name and age. If you forget the patient name inside the station because you are stressed, doctor, look at the paper, don't worry. And here write the CRB fast. Then the WTS. Okay, so let's talk about the case. This patient came with bone aches. And this is a pain. So the good thing, you analyzed the pain according to the Socrates, which are site, onset, course or character, radiation, association, timing, exacerbating factors, and severity. Exacerbating or relieving factor. This is a good thing. Here you should have asked about the associations based on your differential diagnosis. I know that you didn't have so much time. I gave only you 2 minutes, but because the time was running. Then review of other systems. Now I finished this one, I will put tick. Inside the exam, don't worry. Then come to the R, review of other system from above down. And please, doctor, when you come to the thyroid gland, see, you'll ask from above down. If you forgot what are the, how to approach the review of other systems based on your differential diagnosis, bring it from above down. And when you come to the thyroid gland, ask him, do you have any swelling in your neck? No. At this point, ask him, do you have any lumps or bumps at any area of your body? Why I told you to ask at the time of the thyroid gland? Because the thyroid gland, if it is enlarged, it will be enlarged. Or because the part in the neck is protruded. Okay, so you will not forget it. So remind yourself, whenever you reach to the neck, ask about any lumps or bumps at any area of your body. Then go down to other systems. Okay. Come to the past history. The past history, we said, doctors, past history of systolic blood pressure, congenital heart disease. We said S for what? Doctor, any doctor can write. It's okay. The discussion is now open. Doctors, can you hear my voice? Hello? Sorry, doctors, I had a problem in my network. Sorry, I fixed it. Sorry. You can hear my voice, doctors, yes? Okay, thank you. Okay, so S for what? SBB CHD, systolic blood pressure, congenital heart disease. This is a simple mnemonic just to remind yourself. And write it in the exam, don't worry. Blood transfusion, okay? And B here, we see B3Bs for a female. You should not have forget this, doctor. Period. For sure, if you ask her here about her period and she told you that my period is stopped, no need to ask her about pregnancy. And no need to ask her about her pills. Okay? Okay, what is the CHD? CHD, robust history of chronic diseases. Okay, and H for what? Hospitalization, excellent. And D for drugs. And we said before, drugs for us as a physicians means 3 things. We will ask the patient about 3 things. What are the 3 things we will ask the patient about in the drugs? Drugs for us means 3 things. Don't miss any of them. Medications, herbal medicine, and illicit drugs. Excellent. So I finished this one. I will put a tick. Inside the exam, no worry. Then come to the family history of similar problem of chronic disease or of consanguinity if you are suspecting an inherited disease. Then come to allergy. Allergy for any medication, for food, any past history, for example, of bronchial asthma, no. Then come to the S, sexual history. You should have asked about sexual history. HIV, doctor, can cause osteoporosis. Okay, even if she is, doctor, don't assume that the patient is not sexually active, even if she is old. Don't assume this. Ask her in a very sensitive manner. Don't worry. Ask her, and she will not blame you. Ask her in a very sensitive manner, and she will tell you. She may smile and tell you, "I'm an old lady, doctor," but you should have asked about sexual history. Then come to the S, second S for social history. Sharp G. Sharp G. What is the sharp G in the social history? Yes, I can hear someone saying smoking. Housing and hobbies. Housing and hobbies. Alcohol. Good. Or again, recreational drugs. I repeated it again because the case may be secondary to a recreational drug, and B for bets, and G for job. These things, doctor, will make everything easy. I am repeating them every day, because inside the exam you will remember these small things. Then come to the next S, which is the psychological history, and you ask it well about the psychological history. Travel history, you didn't ask about travel history. Lyme disease can cause bone pain. Okay, for sure other symptoms, but it's one of the cause of bone pain. And then come to the WTS. Doctor, why I didn't write S above with here, and why I didn't write this T above with this? Because these three are combined to each other. WTS, weight loss, temperature, sweating. Very important, doctor. If any one of this is positive, ask about the third one, the other two ones immediately. So if he told you that I'm having weight loss, oh, I'm so sorry for that. Is this intentional or no? As you did. It's not intentional, doctor. How many stones or kilograms? About 6 kilograms. For how long? The last 6 months, for example, or the last 1 year. Okay, sorry for this. Do you have any raised body temperature? Yes, doctor, I'm having fever, or I don't have a fever. Okay, and then come to this. Do you have any sweating or any night sweating? No, doctor, I don't have anything from this. Okay, so whenever you are going through this way, here you write every positive data that the patient will give it to you. And before the positive data, you will write the age of the patient here, doctor. Write the age of the patient. Then come to the positive thing that she told you. The patient came only with bone aches or bone pain. She is having some weight loss. She is having some tummy pain, and she told you that she is fatigable, and also she is a lazy person. Okay, so when you finish the things, before asking the patients about her concern, tell her, okay, Mrs. Tay, let me summarize to you what I got from this. So you came with a bone pain for the last 6 months, and you are having some weight loss, about 1 stone for the last 1 year nearly, and you are fatigable, and you are having some tummy pain. Okay? Okay. Is there anything I forgot to ask you about? Any other symptom? Here, this is a very important phrase, doctor, because the surrogate is well trained. Sometimes the surrogate will lead you if you ask him this question. Do you have any other symptom I forgot to ask about? There is any other symptom you want to add to what I said, and repeat this 2 times or 3 times. There is anything you want to add? Yes, doctor, I forgot. I'm having some bleeding, or I'm having some loose motion, or whatever. So she will add to you. So you can add here. Okay, just give me a few seconds, Mrs. Taney. I will be with you. And right, don't worry. This is your time in the exam. He will not blame you. Okay, and you can, even if you cannot reach a diagnosis now, you can pretend that you are writing something for about 10 seconds, 20 seconds. He will not blame you. You will be blamed by Marx if you became silent inside the station. If you became silent looking at the patient or looking at the examiner, this will be against you. Okay, so the patient came with bone pain, weight loss, some tummy pain, fatigability, a little bit old age. She is concerned about cancer. Why she shouldn't be a cancer patient? Why? Multiple myeloma comes with bone pain, comes with weight loss. Chronic myeloid leukemia comes with bone pain, comes with fatigability, comes with splenomegaly, or left upper quadrant pain. So you have to, when you write the things here together, it will remind you. Because you know, doctor, if you didn't write the positive data, which are the problem list, I mean, if you didn't write the positive data, you will forget everything when you come to here. to this point, you will only remember the first complaint, which is bone ache. So you may forget tummy pain, as happened here. You forget that I told you I'm a fatigable most of the time, and I am also a lazy person because you didn't try. So please, if we are practicing the next days in the doctor, please write the positive data. It will help you. I swear it will help you inside the station. Okay. Then the mistake that happened in this station, when the patient asked you about her concern, you went and asked her about her job. No, doctor. She told you, I'm having a cancer. You know, I will tell you how the things are going. Doctor, am I having a cancer? Then you told her, what's your job? Imagine she's worried that she may be having a cancer, and then you are asking her about her job. This will be against you. So once you ask the concern, you have to answer the concern. So the concern is like, you know, the sword. It will cut the things. Once you ask her about the concern, and she provided a concern, you should answer. So I'm so sorry to tell you, to say this to you, Mrs. Tenney, but you know, giving your age, your presentation, cancer is on my list, and we should exclude it. I'm so sorry to tell you this. We have to take it seriously. I don't want to hide things under carpet. Yes, we have to put it on our list, and you have to take it serious. For that, we will do blah blah blah, tests, imaging, bone marrow, anything after this. But at least still here that the concern you are concerned about is come to the differential diagnosis of the patients with bone aches, and from here I will tell you what is the problem. One stone equals, yes, nearly like this, 6.3 or 5, like this. Maybe Dr. Muhammad, maybe he thought that I am telling him that it's 1 kilogram. Doctor, if you are having your exam in UK, mostly the patients will present the things with a stone. A stone equals this number, 6 or 6.3 kilograms. Okay? Or even you can ask him how many kilograms. They are trained for this. I will remove this thing and we'll come to the approach, how to approach the case of bone aches or bone pain. But before going to this, doctor, we are going with the mind map manner, which makes, inshallah, which makes things more easy and to the target, and it will be very helpful in station 5. Okay? If you forget the mind map in any station, please, doctor, go as you were educated in the medical school. What were you educated for the cause of any disease? Any disease, the causes are trauma, tumor, infection, inflammation, autoimmune, what else? Drug-induced, others. Did I forget anything? So these are the things that we have learned in the medical school, how to reach the diagnosis of any disease. You can go by this manner, doctor. Trauma, tumor, infection, if you forget. Okay? The good thing of the mind map, that it will direct you directly to the diagnosis, so that you have to study the mind maps so many times, and you have to remember them by heart. Okay? Yes, yes. I think that this is the mistake, Dr. Muhammad. Yeah, not the mistake. This was the cause of confusion. You said that the stone is a very low thing. No, it's a bulk of body weight. So now, patient doctors came with bone ache. We will come to the differential diagnosis now. Patient came with bone ache. The first question, as Dr. Muhammad did, what do you mean by this bone ache? Is it a joint pain or is it a bone ache generally? No, doctor, it is not a joint pain. Because if it is a joint pain, it will lead to you to another arm of differential diagnosis. So you will ask about any laxity in the joints, any stiffness in the joints, and then we'll go towards the connective tissue disorders, gout, and the poems, which are the cause of laxity. pseudoxanthoma elasticum, osteogenesis imperfecta, Ehlers-Danlos, and the Marfan syndrome. Okay, so do you mean that this is a joint pain or bone ache? No, doctor, it's a bone ache. Okay. Can you please tell me, do you have any weight loss? And this is a clue. This is the second mind map, doctors. We mentioned weight loss. We mentioned weight loss before in which mind map, for which disease? Any of our dear colleagues can remember? We took it 3 days ago or 4 days ago. There was a mind map also starting with weight loss or weight change. It was hypertension. No, not fatigue, hypertension. You can review the session of hypertension on our YouTube channel, okay? So ask the patient, do you have any weight loss? He will tell you, sorry. Make it like this, doctor. I'm so sorry. I will make it in a better way, sorry. Okay, so patient came with bone ache. So do you have any loss of weight? Or do you have any gain of weight? Or do you have any loss but not of weight? Loss only? Okay. Or gain? So we have 2 loss and 2 gain. Gain of fever. And we will see what this loss. So patient came with weight loss. Think about number 1, malignancy. Bone ache, doctor, and weight loss, number 1, malignancy. It may be secondary, okay, or it may be blood malignancy, like most importantly, multiple myeloma and chronic myeloid leukemia. And both can come with tummy pain and they can cause splenomegaly. So malignancy. Number 2, malabsorption. Malabsorption like celiac disease or inflammatory bowel disease. These are the cause of bone pain because both can cause osteoporosis due to low vitamin D, so they can lead to bone aches. Okay. Hyperthyroidism, very important, doctor. Hyperthyroidism can lead to osteoporosis. Pan-hypo, I should bring it above this one, sorry. Pan-hypopituitarism can also lead to osteoporosis. Okay, but all these things can lead to weight loss because malignancy leads to weight loss, malabsorption leads to weight loss, hyperthyroidism leads to weight loss, pan-hypopituitarism also leads to weight loss secondary to adrenal insufficiency. Okay, and we will put here depression. And also depression can be applicable here. Okay, so depression can happen here and it can happen here because the depressed person may not eat and may eat. Okay. Next things from this which can cause weight loss is, as he said, Dr. Muhammad, polymyalgia rheumatica. Polymyalgia rheumatica, doctor, can lead to weight loss, bone pain, fever, high ESR. Imagine as if you are talking about cancer. High ESR, fever, but not that high. It can lead to ESR at the range of 30 or 40. But leads to elevated ESR, can lead to weight loss, can lead to fever. So think about also polymyalgia rheumatica. Chronic fatigue syndrome can cause chronic fatigue syndrome can cause bone ache, but we will not put it here. I will tell you why. Then finally, osteoporosis, for sure, osteoporosis. Osteoporosis also can come here. So osteoporosis and depression can cause weight loss and can cause weight gain together with bone ache. What are the causes of weight gain and bone ache? You can write doctors in the chat box, or even you can unmute yourself. You can unmute yourself, doctor, and talk or write if you would like. Cushing, excellent, Dr. Abdullah. Cushing. And once say Cushing, we should say steroid. So Cushing, yes. Excellent, Dr. Abdullah. Acromegaly. What else, doctors? Failures. Heart failure, liver cell failure, end-stage renal disease. This can cause secondary hyperbara and tertiary hyperbara final and leading to bone aches. Okay, very important medication leads to weight gain, which is lithium. Yes, so also yes, hypothyroidism. Okay, and hypoparathyroidism. But hypoparathyroidism does not lead to weight gain. Okay, so these are the causes of weight gain with bone aches. Come to loss. Insulinoma. Okay, I don't know if insulinoma causes bone aches or no. I don't know, but we can search for it. Okay, so we said cause of weight loss and cause of weight gain, and then come to loss. Loss of what? Loss of hearing. Loss of hearing, Paget disease, doctor. Did you notice any change in the size of your head? No, or yes. By the way, doctors, Paget disease, also Paget disease can lead to heart failure, shortness of breath. Okay, and it can lead to carpal tunnel syndrome. So Paget disease can lead to high output heart failure. It can lead to carpal tunnel syndrome. It can lead to bone aches, bony aches, or bony pain. Okay, calcium is normal, BTH is normal. What's high in Paget disease? What's high? What's the elevated? The biochem is alkaline phosphatase. Okay, so hearing. By the way, Paget disease, doctor, is very prevalent in UK. It's 5% of the people in UK having Paget disease. But Paget disease is a symptomatic disease. So only 5% from this 5% will be symptomatic. So imagine 5% from the 5% will be only symptomatic. And the treatment, as you know, bisphosphonate. Okay, so we said here, loss, hearing loss or menses loss. Post-menopausal females, they may have bone aches. Okay, so hearing loss or menses loss. Last one is gain of fever, Lyme disease, HIV, osteomyelitis. But here osteomyelitis osteomyelitis will not stay with a patient for 6 months. Okay, acute chest syndrome, sickle cell anemia, but for sure it will not stay with. But these are the causes of weight of bone ache. Okay, so doctors, now you can think that the things are confusing, but if you study this mind map 2 or 3 or 4 times, it will not take from you 10 minutes to remind the things. Tomorrow you can repeat it again. After tomorrow you can repeat it again. Then you will remember it by your heart. So again, patient came with bone ache. What do you mean by this bone ache? Do you mean that this bone ache is, sorry, how can HIV cause bone pain? It leads to osteoporosis, leads to HIV. See, doctor, I will tell you something. Yesterday we said, if I am going to MRCP basis, my case is lung cancer, or what is the second thing that we said? It will be lung cancer or till proved otherwise. Any doctors with us? HIV. Okay. So if you are going to MRCP basis, my case is lung cancer or HIV till proved otherwise. Okay, so HIV can cause anything. It can cause anything. Even it can cause myocarditis. So it can cause joint pain, can cause Kaposi sarcoma, it can cause neuro manifestations, it can cause anything. It can cause diarrhea, tummy pain, it can cause chest manifestations, pneumocystis carinii pneumonia. Okay, it can lead to activation of TB because TB and pneumocystis carinii are AIDS divining disease. Okay, so my case in patients is HIV or lung cancer till proved otherwise. Okay, doctor. So now patient came with bone ache. Do you mean that this is a joint pain or bone ache? No, doctor, it's an bone ache. Okay, can you please tell me more? Do you have any weight loss? Yes, doctor. So you will go in this way. No, I don't have. Do you have any weight gain? So you can go in this way and bring it from above down. So I didn't make it in a good order. It should be better from above down, acromegaly, then go down a little bit, hypothyroidism, then Cushing syndrome, then steroids for sure, then failures of the organs, and finally lithium and depression. Okay? No, doctor, I don't have this or this. Do you have any hearing problem? Yes, doctor. Think about Paget disease. Okay? Or can you please tell me more about your period? It stopped, doctor, already for the last 3 months or 3 years. Oh, I am so sorry for this. Do you have any hot flushes? Yes, doctor, I'm having hot flushes most of the time and sweating as well. Okay? She doesn't have anything from this. Ask about travel history to endemic area. Ask about any extramarital relationships, any shared needles and tattooing, any blood transfusion. Okay? Or ask if it is acute, you can ask about osteomyelitis or acute chest syndrome. Okay, doctor, everything is clear now. How to reach a patient with bone ache? Any question till now? You can unmute yourself at any time, doctor, if you would like to. Do you have any questions, doctors? Any concerns? I want to add something, yes, before anything. See, doctor, unaccept any, put it as a rule. Any unexplained GI symptom like nausea, vomiting, tummy pain, consider celiac disease. So if you found the case and you tried to reach, because we are having a case of celiac disease here, the malabsorption, okay? If you ask it about everything about celiac disease, diarrhea, nothing, no diarrhea, lactose intolerance, no, pasta or macaroni or bread, or despite this is rare to be told, but you have to ask about this. You couldn't find anything. Also, still think about celiac disease. Okay. Okay, doctors. Any question? Any questions, doctors? I finished already today because I have other things to do. So thank you very much.
Excuse me, Dr. Khaled.
Yes.
I'm finding difficulty how I should attribute this case to either celiac or multiple myeloma. They almost have the similar presentation, yeah?
Okay. But see, doctor.
My positive data.
Oh.
My positive data for this patient, I'm writing it like a triangle, drawing it like a triangle. On the top, a female, middle age. At the lower left triangle, bone ache, low mood, loss of weight, and fatigue. And at the right lower triangle, abdominal pain. Are my positive data correct?
Yes. Bone aches. Okay. Bad mood, weight loss, tummy pain, and fatigue.
Yeah.
Yes. Yes, doctor. So, do you think that the patient with celiac disease is having bone ache all over the day, or a patient with celiac disease does not have diarrhea? Okay. He doesn't have diarrhea at all. He asked about loose motion. He said no. Any blood from any area of your body? He said no. For sure, he should have asked about mouth sores to complete the things, but no. But patient with celiac disease will not have bone pain all over the day. The patient who is having bone aches most of the time, this is multiple myeloma or chronic myeloid leukemia, for sure. Because this is the main presentation. You know, doctor, I will tell you something very, very strange in patients with chronic myeloid leukemia or multiple myeloma. If they got an infection and they started to cough, the ribs may be fractured because they are very fragile. So patients with multiple with celiac disease, for sure he will have things very prominent like diarrhea, like for example mouth sores, like tummy pain most of the time. Okay, and the presentation will not be bone aches for sure. It's a side symptom. It's a bypass or it's a side symptom, not the original, not the main symptom. Is it clear now, Dr. Akil?
Yes, it is. Yes, it is, Dr. Khalid. Thanks a lot.
Okay.
Thanks a lot.
Thank you. Yes, I forgot to just explain one thing before closing the session, the chronic fatigue syndrome. Okay, chronic fatigue syndrome, doctor, it's of exclusion. Okay, those patients can come with headache, can come with lymph node enlargement, can come with sore throat, can come with muscle aches, memory problems. What else? Come with malaise. For sure, muscle ache or bone aches. Okay, but this patient will not have. You didn't ask about other things. At least she should have 3 or 4. I think 4 from this. Still, there is one point, but I cannot forget. I cannot remember it now. So 4 out of these things for the last 6 months. So you asked here about headache. She said no. You asked about lumps or bumps. She said no. You didn't ask about sore throat, so it should be no. Memory problem, you didn't ask about it. Malaise, yes, she is having malaise. Muscle ache, yes, she is having muscle ache. Okay, so you cannot say simply that this is a chronic fatigue syndrome. No, you cannot say like this. Bowel motion will be opposite joints pain more than 6 months. Okay. Okay, doctors, we finished the session today. If you have any drawbacks or any questions, you can send to the WhatsApp group. Thank you very much. Assalamu alaikum wa rahmatullahi wa barakatuh.